Okay, we are recording this so people can watch it later if they want to. Should go again? Okay. So welcome everyone to the webinar on compassion-centered spiritual health. My name is Tim Harrison. I'm the Associate Director at the Emory Center for Contemplative Science and Compassion-Based Ethics. And Maureen will introduce herself in a moment. Just wanted to say it's nice for everyone to be here in person and also on the internet. And it's good.
Okay, wonderful. So go to the next. So we're here today and we're so glad you're here. Again, welcome. My name is Maureen Shelton and I direct the education program at Spiritual Health at Emory Healthcare. I'm an ACPE certified educator as well as a certified CBCT instructor, and it's wonderful to be here to share this with you. Look forward to the time together. This is our slide to introduce compassion-centered spiritual health. And our mission is to support spiritual health individually and collectively through contemplative practice aimed at strengthening and sustaining compassion rooted in our common humanity. So we'll be exploring what this collaboration has been and is forming and is continued to form of compassion-centered spiritual health throughout the webinar. We have hopes and we have had in our personal experience that this has been supportive of the core values of ACPE, APC, and all our strategic partners, and we're looking forward to the ongoing dialogue. So we'll be covering the following in this webinar. Welcome. What is compassion and why do we need it? What skills cultivate and support compassion? The research benefits of compassion training. One method of training compassion, CBCT, cognitively based compassion training. An overview of compassion-centered spiritual health, and then next steps, how you can become involved in the effort. So that's what we hope to cover together today in our 2 hours. And just to let you know, we do have somebody who's monitoring the chat, and also the technical pieces. If there's any challenges, we'll be monitoring those.
Is everything going okay so far? Okay, great. So,
So we're going to start out. One of the things we're learning about Zoom is that there's this interaction capability, and we're going to ask you to participate in some polls, those of you who are participating from around the country. So this first poll that we're going to send out to you, and if you could participate by responding, we'll get to see the summary of our responses up here in just a moment. What part of the country are you calling from? And to select from those choices. And what percentage would you estimate at your clinical site do you estimate folks who suffer with burnout? So we'll send that out to you right now if you could respond. Okay, there we go. Is it about? See, got a few more people.
yeah,
Looks like
we've got about half the people have answered, so we'll keep waiting. Another 15 seconds or so. Three.
I think we have some people from multiple folks in some sites.
Okay, should we close it?
Yeah.
So we're closing it, and I think I can share the results here. Let's see.
Yeah,
Is it working?
yeah.
So Midwest wins the first question. 28%, that's interesting. But otherwise, well spread out. And then 20 to 40% estimate the evidence symptoms of burnout in the clinical side. Thank you for doing that. Someone in Germany, oh, we didn't get to, I'm sorry we didn't have an other. So next time we'll have to do that. Okay, stop sharing results. Okay, thank you. So this isn't clicking forward, so maybe, there we go. So we wanted to start with a little discussion of burnout and a recognition that burnout is a growing concern in the healthcare professions. Physician burnout seems to be getting the most press, but it's pretty clear that it's part of all healthcare professions these days. And it's what's become apparent in our work with people in medicine, and we'll talk about how CBCT has been used with physicians, nurses, and chaplains as well, is that it has different skills that are part of this, the training that address each of these three main symptoms of burnout you see in the bottom right. These are scientifically validated burnout scales: emotional exhaustion, depersonalization, and a sense of reduced personal accomplishment. We also wanted to start by mentioning an interesting study from about 3 years ago, comparing three types of experiences. And one was a compassion training. I have to spend a little time explaining to you what this is, but we just thought it was a really nice way of understanding the relationship between burnout and compassion, potential relationship. On the left of each of these charts, CM is compassion meditation. So the people were given a very kind of brief set of recordings, very basic kind of compassion meditation technique. And the center, oxypla, it says, is a placebo where people were told they were getting a nasal inhalant that would administer enough oxytocin to make them more compassionate, even though the evidence doesn't show that oxytocin necessarily does that, and it was just salt water in the end. So it was just placebo intervention. And on the right, the familiar or FAM, that category, the third group was just a treatment as usual group. They received no treatment other than doing the study tests. Now, this is where it gets interesting. The study tests that were done were exposing people to stories of people suffering, real people telling their stories about being experiencing loss or abuse, or some of them are very disturbing stories, actually. So, and over the course of this, I think 6 weeks, though I'm not sure the time exactly, they were repeatedly exposed to these stories of suffering. And what the scientists were interested in the outcomes, on the left chart, this changes in FAST scores. FAST stands for something that basically means the compassionate response of the individual. So they had ways hello, welcome. They had ways to measure both through self-report questionnaires, but also through some kind of eye tracking, computer analysis, how connected people were feeling to the story and how compassionate their response was. Well, as you can see, those who had compassion meditation, their compassionate response actually went up. The oxytocin placebo actually did help. It kept them at least staying the same, because what's really interesting is those who were just consistently exposed to the suffering of others without any kind of technique or even a belief that they had the ability to sustain a compassionate response, their compassionate response actually went down over time. So the researchers proposed this could definitely explain why some people get burned out. And then also interesting, but not 100% on point here, but the other finding that was interesting is the compassionate action. In this case, they were offered a chance to donate at the end of the the study. They could donate a portion of their study fees that they received to a charity of their choice. And those who had had the compassion meditation intervention donated more than the other two groups. So, so there is some evidence of actual behavioral change as well. So let's talk for a minute about what is compassion. Maybe the people in the room here could say the words that come to mind when they hear this word compassion. What do you think?
Open heart.
Open heart. What else?
Empathy.
Empathy, yeah, for sure.
Wishing people to be free of suffering.
Wishing people to be free from suffering, yeah. So we have a very specific definition in our program for compassion, and it includes everything you all have just said. But we like to say it this way: it's an affectionate concern arising from the witnessing of distress and difficulties of others, which wishes to see that suffering or difficulties alleviated. So it's this very other-oriented emotion, if you will, or motivation to help others, to see them to get better. Some people, the way we think about compassion, what we realize, and we'll talk about this more, is it's not quite the same thing as empathy. If you think of empathy as my ability to understand what someone else is thinking, or to understand how they're feeling, or even to share feelings with another, that's not necessarily the same as wishing them to be well or free from their difficulties. So I know sometimes we use empathy and compassion interchangeably, but for us it's more important to realize they're two different concepts here, because there's this common misconception that compassion can lead to burnout that we have, that some people say, oh, well, that's my problem, I'm too compassionate. And why would I want to train in compassion? It's just going to make things worse if I'm even more compassionate. And the observation that seems to be coming out of the compassion science is that it's not the compassion that is burning us out. It's the empathy. It's that emotional resonance that's making me kind of stuck with feeling the same way as the others that I'm tending to or serving. Compassion, as we see here, doesn't require me to hold on to those feelings myself. They can, they're certainly part of it, but they're not the main part. So we like to say that in our program, compassion doesn't lead to burnout. It's actually an antidote to burnout. So that's going to be part of a theme that we're going to explore today, and ask you to just consider, if that's a new idea, just consider, is that actually possible? And this is based very much on this note at the bottom now: empathy is not the same thing as compassion. And again, we'll talk more about that.
Thank you. So we wanted to bring in a quote from His Holiness the Dalai Lama, and I'll read that out for us. Compassion and love are not mere luxuries. As the source both of inner and external peace, they are fundamental to the continued survival of our species. There is nothing amazing about being highly educated. There is nothing amazing about being rich. Only when the individual has a warm heart do these attributes become worthwhile. So in compassion-centered spiritual health, we really focus in on this idea of warm-heartedness. What can we do to help cultivate this sense of warm-heartedness in our work? Sustainable warm-heartedness. So one way we wanted to visualize some of these core skills, these core aspects that lead to compassion, was this visual representation. And you can see what our attempt here is, that these are clouds. And what we want to talk about is, what are the skills that help to disperse these clouds? And on these clouds, you can see these different pieces written that represent the roadblocks to compassion, some things that can get in our way of offering this warm-hearted care that we would like to. So agitation and stress was that first cloud. And the skill that we nurture to help disperse that cloud is remembered nurturance. And we're going to talk more about these individually as we go through the webinar. Distraction. What we nurture to dispel that cloud is calm presence. Rumination and anxiety. We cultivate mental flexibility. Our self-judgment. We nurture a sense of self-compassion. Prejudice or favoritism. We cultivate and familiarize ourselves with this sense of inclusivity through these skills that we're developing. Isolation, which is such a prevalent piece in our culture. This sense of gratitude and affection. And empathetic distress. We nurture a sense of empathetic concern. So these are all very important skills that help us to have this kind of sense of agency, that we can disperse some of these roadblocks that come in regards to our offering of sustained warm-heartedness. So here in this slide, we are pairing some of these skills and these values with some Roman numerals, which correspond to the modules of CBCT, which we'll be talking about more. And this is to point to some of the systematic curriculum that CBCT is, that goes through these skills. You can also see, I'm sure we can resonate, that a lot of these skills and values are things that we value in the work of spiritual health. And so these are, we find these to be correlated, the gifts that nurture, the values that nurture compassion, to the work we do in spiritual health. And that we see and hope that nurturing both of these skills are going to help us in our core values, in our work, in our professions.
Slide up. Okay. Right?
Yeah.
Yeah. So it's a good time to take a moment and say a word about what this CBCT is. It stands for for those who haven't heard of it, it's called Cognitively Based Compassion Training. And it is a meditation program developed here at Emory University. We'll say even more about that later. But the important thing is that it has become the basis for compassion-centered spiritual health in this collaboration between the Emory College and the spiritual health at Emory Healthcare. And the basic goal of this contemplative program, CBCT, is to give each individual the tools to cultivate each of these 7 values or attitudes or perspectives, skills, if you want to call them that. So if we're going to do another poll now, actually, with all 100 people who are here or more, and say, if you yourself, you think about the work that you do, you know, which of these skills, if you think of them as skills, would be one that you would really appreciate having time and tools to train, to cultivate? Which of these would you most like to embody even more than you already do? And trust me, it is our deep belief that each one of you already has these skills already. You know, it's our, that's the place we're coming from. But still, we also feel each one of us can get a little better. So if you had to pick one, what would it be? So let me see if I can start the poll for that one. Poll number 2. So go ahead and pick one. If you're watching with a group, you may have to just take a vote amongst your group. If you can do that, we'll try to do this in about 30 seconds, 45 seconds. I could be like a race commentator and tell you who's winning, but I don't want to influence the, oh, this is very interesting. For those in the room, what do you pick? Just call it out. 6, empathetic concern. Anything else?
Remember nurturance.
Remembered nurturance.
Yes.
Yeah,
good.
we're
Yeah,
going to talk
sounds
more
good.
about that. That's others. We've got 70% voted. So 10 more seconds.
That's interesting.
Okay, this is interesting. Let me share this. So self-compassion is a close winner with mental flexibility. And then remembered nurturance, which we've accidentally misspelled. Maybe we need some self-compassion in light of that. Is also up there. That's so interesting. Very low votes for affection and inclusivity. But still, hopefully we can all agree we can still get better at all of these things. Well, thank you for doing that. Let's hide this, stop share. We're going to talk through each one of these actually, and so try to give you a sense of what we mean by them. But first, we wanted to review a little bit more about CBCT, this cognitively based compassion training, and talk about its research basis and some of its programs. How are we doing with time?
You're doing good.
Okay. Trying to start that. Oh my goodness. Slow down. Any questions coming in? So once again, so CBCT, Cognitively Based Compassion Training, it was a program developed in 2004 here at Emory by a man who spent almost 3 decades in a monastery in South India, a Tibetan Buddhist monastery. He was born in India, and Lobsang Negi. And he developed this program trying to work with various insights from the contemporary Western ideas about emotions and mental health. After coming to Emory, getting his PhD here, and he's now a professor at Emory and an executive director of the Center for Contemplative Science and Compassion-Based Ethics. So this program originally was developed and offered to freshmen at Emory University as part of this research study that I'm showing a slide of now. And in this study, they compared a group of people well, it's actually an in-group comparison. So all the students took CBCT and then were subjected to this test called the Trier Social Stress Test, where you are put in front of a panel of so-called experts. In fact, they're actors. And you're asked to speak about something important to you, like what you'd like to do with your life, your career. And these actors are instructed to never smile, never give any positive feedback. It's quite stressful situation. It's basically the most stressful thing you can do to someone legally in a laboratory setting. And it inevitably works to raise the speaker's cortisol levels, interleukin-6 levels, adrenaline levels in the blood. The body responds in a very stressed way. And so what the researchers wanted to know was, can this meditation practice change that? Can it soften the kind of blow, if you will, of this basically social rejection? Here you are trying to tell your story to people, and they're just, not giving you any feedback. And this particular slide is about interleukin-6. This plasma interleukin-6, that's an inflammatory marker. So it's a marker in the blood. They're actually taking blood samples from the speakers while they're speaking. And it shows that for the students who practiced this compassion meditation the most in a high practice group, and then we're only talking about 15 minutes a day for 6 weeks here. This is not, going to the mountaintop and sitting for 40 days. They showed remarkably lower levels of inflammation in the blood in response to this social stressor. compared to the low practice group and also the weightless control, or maybe it was just an active control. Yeah, it was an active control. The same sort of graph came out when they looked at their cortisol levels, and cortisol is a stress hormone. So this was some very promising early research and led to a whole series of studies that have, at this point, made CBCT the most studied compassion meditation program basically in the world. Most of them are in the United States. There's 3 or 4 out there that are quite robust and active. I just want to talk through a few of the other research findings. There's evidence that the CBCT enhances empathic accuracy. This is a test where people try to identify emotions in facial expressions. So it's a validated psychological scale, and those who do this compassion meditation seem to be able to identify more accurately the emotions of others. So that's empathy. And what really interested the scientists in this case was they also had more activity in the part of the brain associated with empathic reasoning. So they were doing brain scanning as well at that point. That's what that one is about. Amygdala response went up. CBCT has been used in a number of situations with foster children in the Atlanta foster care system, showing, again, reduced salivary C-reactive protein, that's a stress hormone, and increased hopefulness. It's been offered and continues to be offered for 5 years now, I think on Wednesday nights at Grady Hospital. This is Atlanta's in-town urban hospital, right in the center of things. Offered by an Episcopal priest who's become a CBC teacher, and she has developed a way to offer this to suicide survivors, many of whom are indigent or even homeless. And studies are showing some wonderful outcomes, including reduced shame, reduced depression, and increased self-compassion. Some of the most remarkable results are from a pilot study in San Diego for veterans with PTSD out of UC San Diego. And those folks have actually sent a psychologist, an expert in exposure therapy, and been trained as a CBCT instructor at Emory. She has adapted CBCT for therapeutic usage. And they're looking to do a multi-site trial now, but it's a remarkable decrease in PTSD symptoms. There's also a wonderful program here in Atlanta with educators. You may or may not know, but urban educators, if you get out of school, graduate from your teaching college, and then start teaching in an urban school, there's a 50-50 chance that after your 3rd year, you will have quit teaching forever. This is a tremendous waste of energy and talent of our young people. And so this wonderful program is using CBCT as well as a mentoring program and a professional development program to support new teachers in Atlanta public schools. And so far, after 3 years, it's just initial data, but almost all have at least stayed in the teaching profession for these first 3 years. It's only a 3-year-old program, so long-term results remain to be seen, but it's been a very rewarding program to be part of. We're also teaching CBCT in other K-12 schools, such as a couple of schools in Atlanta, Peoria, public schools in Illinois, and at a preparatory academy in Mexico City. I'm sure you'll be interested. CBCT has been offered in many parts of the healthcare industry. The initial offering came when the dean of the Emory Med School took CBCT and had this sense that this could really be helpful for all of these physicians he knows who are burning out, in particular the students he was educating, who he knew he was preparing in a way for this very difficult trajectory, in which you've probably seen the statistics, but physician empathy plummets the 3rd year of med school. I mean, they come in with idealism and heart, and then it sort of tanks. And then it does creep back up slowly after that. But he wanted to know if we could buffer the students against that. So we've been offering CBCT in the med schools, also at the University of Illinois Med School, and in Brazil for about 4 years. All the students have the opportunity to take this meditation practice. Emory's now offering continuing nursing education. You can get credits as a nurse to take CBCT. And we've been asked to teach it at the Cleveland Clinic and the Cambridge Health Alliance in Cambridge, Massachusetts. There is a study on the med students here at Emory showing that it does seem to buffer against depression, loneliness, and increase self-reported compassion. It's a pilot study. And CBCT has been offered in a number of other healthcare settings. So wonderful results with breast cancer survivors. 2 different studies, one in Tucson, Arizona, one in Valencia, Spain. All the materials are translated into Spanish, Portuguese, and German at this point. Here in Atlanta at Grady Hospital, Grady Clinic, we're allowed to teach CBCT to men living with HIV positive with promising outcomes. And also in Germany, a study offering CBCT to depressed patients, clinically depressed patients, and their partners together. Very promising. And last but not least.
Thank you. So we're thrilled to be part of this research effort here at Spiritual Health at Emory Healthcare. This is our team this year. This is our interns, residents, and staff that we have right now in our system. And we're in our blue coats, which we use to identify ourselves in the hospital system. And so, again, as Tim was saying, this is the Compassion Centered Spiritual Health. We've been using CBCT as part of our curriculum for the last 3 years for our chaplain residents. They get the full foundation course. And out of that effort, when we started to see that this could be a benefit, we decided to do some research. And so we have a privilege of having a director of research, Dr. Chuck Rizan, who's one of the first researchers of CBCT, Dr. Jenny Mascaro, Chaplain Kim Palmer, who is one of the awardees of the Transforming Chaplaincy Grant, who's on our staff now, and has got a degree in epidemiology in the School of Public Health and is now our manager of research. And we have many other wonderful people working with us on our research effort. So we have 2 different pieces of our research in regard to compassion-centered spiritual health, and we just received last year a peace grant from the Mind and Life Institute from the University of Virginia, and we were thrilled to receive that grant to support this research. So we have 2 branches, one that is looking at exploring how it is of benefit, if it is of benefit, to the residents. And then the other branch of the research we just started this year, which is looking at some interventions for the bedside practice for our spiritual health clinicians that are inspired by CBCT. And we just did our first training with the residents of the interventions this year, and we're just launching that research. So we look forward to learning and refining that. We have a manual that we've developed regarding that, and we're continuing to refine that, the work on those interventions. And look forward to what the research says. So one of the studies I just mentioned about the studies in regard to the residents, that branch of the research, we have a pilot study. We just got this data compiled, and this was in regard to our chaplains from last year. And you can see here that the first column is measuring anxiety, and the blue line is folks who've had the CBCT in the fall. And the red line is the folks who were waitlisted and did not have CBCT until later in the year. So this is just measuring the folks that were able to be exposed to CBCT, and it's comparing it to the control group. So the blue line, as you can see, pre and post, the anxiety was significantly reduced by those who were able to have the CBCT curriculum and supplement to the CPE curriculum. And then the burnout was also decreased by these participants. The anxiety is a little bit more significant in its impact. So we look forward. This is very promising, according to the researchers, and I'm learning a lot in this process. And that's why we're continuing to do more research in this year and the years ahead. So to return back to this slide, as Tim was saying, there are these skills that are paired with each of the modules. And again, I think these are so valuable for spiritual health care because they give us some more tools, some more empowerment for our emotional regulation, for our mental hygiene, so to speak, so that we can navigate varied emotional and behavioral responses more consistently, with more empowerment, and being able to sustain more of this warm-heartedness through that successful navigation through this training. So the good news, one of the things that I've really been excited about in this curriculum is that it has this sequential nature of these core skills and practices and values. So we're going to go through each one of these, as Tim was saying, and each one of these skills build on the other. So a lot of times, like in our work and our core tool of verbatim, for, like in ACPE, CPE, we explore all these wonderful pieces that come up in the group. And everybody in the group, in my experience, learns alongside the people because the format is so nutritive of insight, the action, reflection, action process. And what I found, and we're just going to explore to see if this is true, that having this undergirding curriculum helps us to more consistently engage some of these core concepts if they don't come up spontaneously in the verbatim. So that the folks can say, like, oh, in the verbatim, I'm noticing I'm having some trouble with cultivating impartiality, this idea of inclusivity. I'm going to go back and do some of those practices to see if I can cultivate some of that for myself in a more sustainable, consistent way. And they can say, oh, and some of our folks have said, I've noticed that because I've gone through this over and over and over again, because this is not a linear, this is a looping over and over again exposure. They can say, oh, I was able to maintain my focus a little bit longer in a challenging visit because I was able to sustain my attentional focus. And then that helped me to be able to utilize some of these other skills which are moving towards the goal of offering compassion in a more sustainable way. So we'll talk some more about each one of these and what we mean by these terms. So meditation, we've talked about that briefly. We referred to that this is a core aspect of CBCT, contemplative practice. And what we mean by meditation is not a clearing of the mind. Sometimes folks think that you're just trying to get a clear mind. And as we all know, that can be very challenging. In this practice, and there are some practices that I'm sure it's wonderful in terms of a way to pursue meditation. But in this practice, we mean to cultivate new habits and qualities, or to familiarize as with gaining new perspectives and understanding. So we're becoming more in relationship to the inner world. And we have a lot of skills of this from our own faith traditions, from CPE, from other practices. And again, just to make this a systematic exposure to how to deepen our practices with some of these insights. So each one of those modules that we just looked at is paired with a meditation, so that folks can get a sense of, okay, I've heard the concept. Now through the meditation, I can go and get some in-depth exposure to that concept, because each meditation is a guided teaching meditation that's paired with each one of these that you can go to over and over again to become more familiar, to cultivate more that inner skill. And what we found is people have said this has complemented their own spiritual health practices, because these are skills that people can map onto their own spiritual health practices as it makes sense to them or not. But to be able to cultivate that relationship to the inner world has been, I think, something that I've heard the resonance in for myself has been a great benefit. And we want to be realistic. That's why we talk about these kind of levels of learning. You hear the concept, you have some time to immerse yourself in these concepts through the meditations. You get this more sense of personal aha through that depthful encounter. And then you can start to embody. I think so many times in our work, we think we should just hear a concept and then be able to just spontaneously utilize that concept. And in this practice, as we know with the action reflection action method of CPE, this parallels that we have that time to have our own personal aha with each of these concepts. Just want to build on what Tim was pointing to earlier, that this protocol was put together by Professor Lobson Tenzanegi, who's the Executive Director of the Center for Contemplative Science and Compassion-Based Ethics. And that this protocol was taken and inspired by the Lojong tradition, which is translated mind training tradition of Tibetan Buddhism, and combined with insights from the contemporary emotion science and neuroscience. That's a great picture of him there. And it's secularized with great respect to the Tibetan tradition, secularized so that the practices are available to individuals of any or no faith tradition, which I think we're finding in our work, that we want to be trained to be tuned to how to offer the best care we can to people from all these different faith traditions or no faith tradition. And we find that these skills can be transferable to that skillful execution of that offering of spiritual help. I think that's turning back to you.
Yeah. Okay. So I would just pause for a moment and say, I noticed that we're getting a notification that a couple of people have raised their hand, which is not something we had prepared for. I think we would ask you that if you have a question, to put it in the chat, the Zoom webinar chat, and we are monitoring those, the chat. So let's see if that works. And then, and we do hope to have time for questions at the end. So if we do well, we'll do that. Let's see. The next thing is, it's time to start talking through these seven different practices, 7 different skills. I think it's such an unusual idea, or certainly was for me when I was first exposed to it, that compassion would somehow be this product of a number of different skills that I had. I think if you're like me, that you were told things when you were young, like, oh, and so is really compassionate and so is not very compassionate. And you got this sense that you either were or you weren't. And fortunately for me, it is something I feel like I've been able to improve on or get better at over time. And I think in many ways, there are many ways to get better at compassion, and these 7 are not the only ones, but it's a unique way to lay out a system that goes in order. And for those of us who've been exploring it, it really seems to make sense over time. So the first one, I'm going to click this button. First one that we'll talk about is foundation, resting in a moment of nurturance, or as it said on that sunshine slide, remembered nurturance, is a practice, let's see, which we'll describe in just a moment, but it's a practice that we start with because, as human beings, we need to be in a settled place if we're going to really practice anything. So even before we get started with module 1, 2, 3, 4, 5, and 6, there's this idea that we need to have some way to come back to being grounded, being present, and settled down. And really, we enjoy a model for understanding this that comes from Elaine Miller-Karras of the Trauma Resource Institute in Los Angeles. And her focus is on resiliency, which we could define as this ability to recover readily from illness, depression, adversity, or the like, buoyancy. And the idea is that we all can be resilient. but only when we're in a place that we're calling, for this program, the zone of well-being. This is really a physiological situation. We've got a nervous system that has a sympathetic nervous system that when it's triggered, it arouses us, it gets us all excited, can get us too excited. And then when we get too excited, the parasympathetic system is a different system that kicks in. It helps us to calm back down, to chill out, relax. And basically all day long, these two systems are monitoring, checking it out. From the moment we were born, they're making sure that if possible, we stay in this zone of well-being. So there's a high end and a low end to this zone. And ideally, if it's a pretty good day, there'll be some ups and downs, of course. It doesn't mean we're not having emotions. We can have very strong emotions. But we're not being knocked out of this zone. If you're out of the zone, I don't know for those in the room, what words come to mind when you think about being out of the zone of well-being? What does that look like? Overwhelmed, yes. What else?
Uncentered.
Uncentered.
Literally off balance.
Yeah, yeah. So there's I have another slide here that shows, kind of illustrates what can happen when we have a very strong trigger. This could just be, you can imagine why we would be wired this way when we used to have to live out in the natural world all the time. There might be a poisonous snake coming along the path. We'd want to, of course, you want to be triggered by this. You want to have your sympathetic system go into shock and you fight, flight, or freeze, right? You run away, you do something without a lot of thinking. And you become very narrowly focused on that one thing. But if we get very strong triggers or a series of triggers or a trigger that reminds us of traumatic memories, can really throw our whole system out of balance. And you can see by this illustration, the idea is that we can start going high and low, kind of back and forth, to the point where we actually get out of the zone and maybe even get stuck there. It's not so bad to get out of the zone if we come right back in, but if we get stuck in the high zone, for example, words like edgy, mania, rage, I can think of road rage. If you see someone jumping out of their car and screaming and yelling at someone, they're probably out of their zone on the high side, right? On the low side, what does that sound like? If you get stuck below the zone, what would that be? What comes to mind?
Apathy.
Apathy. Exhaustion. I'll show you our words. Yeah. Exhaustion, depression, fatigue, numbness, kind of emotional numbing. So basically the idea is that these beginning practices, whenever we sit down to do a meditation practice, or frankly, to go into a patient encounter, it's nice to just check, where are we? Where am I in my zone? Am I close to the high end, the low end? Especially if I'm near the high or low, maybe I should do some practices, centering practices to come back in. When we teach this to teachers in classrooms, this makes so much sense to them, because what you realize is your students will not learn anything if they're not in the zone of well-being. So if you have a child, if they're having a fit, so that's not the time you try to teach them a new skill, right? You have to help them calm down, and then you can teach. So same with us, same with ourselves.
Yes, so going back to that foundational practice that was in that list that we have, this is, as Tim was saying, we want to check in with where we are with our own zone of well-being. And often what we found is to start with remembered nurturance, a foundational practice of taking that time to access a time where we can remember a time where we felt a sense of support and nurture that was for us. Because we know that so many times we go from encounter to encounter, situation to a situation, and we can often forget to really slow down and fill up for ourselves. So we start with this foundational practice to recall a time when we felt that sense of nurture and support, and vividly, as much as we can, we bring that to our mind's eye so we can feel like we're there again and experience it and take it in. And that also gives us a way to imagine what it would be like to offer that to others that we come across, so that we don't have to just come to that out of sheer will, but that we can check in and remember when we've received it and feel what that feels like. It's also helpful because as we go through the modules, it's a combination of mindfulness practices as well as analytic meditation. Mindfulness, kind of the more traditional settling of the mind and body, becoming more present in the present moment. And then moving to this more analytic parts of the meditation where we're looking at things from different perspectives. And at times that can take some courage because we are examining things from different angles and seeing how we might get some new insight. And so we want to always have a place, wherever we are in those modules, to be able to go back to that foundational practice for ourselves. We don't want to force anything. And this is very parallel with what we hope for in the spiritual health encounter. We don't want to force anything. And as our folks are taking in this practice, as well as pairing it with their own faith practices, perhaps it's giving them this sense that we've heard some people say, is that they're getting more of the muscle to slow down and do this for themselves. And then to pair that with some of their faith practices as well. Here's some beautiful pictures of some images that can be times of a nurturing moment. And again, this does not need to be a perfect moment. It can be any moment where you felt that kind of receiving of care and love. And it could be with a relationship in the past or present, or it could be with a pet, or a time in nature, or a connection with your time with the divine, if that's something that's part of your faith practice. An image that helps you connect to that sense of security and warmth. And we have a former resident that we wanted to show you some of his insights about this, and particularly how he mapped this onto some of his own faith practices.
Forward it one. Get forward.
CBCT is all about meditation, taking time out, and that goes right along with my practice. And we realize that it's important to take time to meditate on specific scriptures, to give myself peace and a better understanding of life. So it works hand in hand.
Appreciate his making that connection for himself. And that's what we want people to have spaciousness about doing that for themselves, how they connect it to their own faith practice. So after we've had that sense of grounding ourselves in the resting in the moment of nurturance, that remembered time of nurturance and support, then we can move to the next module and build on that skill of attentional stability and clarity. And as we know in our world, there's so many things that can distract us. And I know I catch myself, how many things am I multitasking at any given moment? And what that does when I am really trying to have the intention to be present to the other in front of me. So this skill development gives me that practice of, in the CBCT practice, we have a focus of our attention, which is often the breath, because we carry that around with us, but it can also be something external if the breath is triggering for us. It could be a candle, an electric candle, or it could be the grounding of our feet, feeling our feet on the floor. Anything that we can just focus on our attention, to train our attention. And what's wonderful about this is you can't do it wrong. Because what we're doing is we're just practicing, here's my attention where I want to focus my breath, let's say. And my mind, guess what, is going to wander. It's going to go off, and it's very normal. But the skill is this kind of introspective awareness is catching that, disengaging, and then refocusing over and over again. So we're building that muscle that we all have. We all have these muscles, just like we all have the capacity for compassion. But we're just going to the gym. We're building these muscles of attentional stability and clarity. So a slide that we find helpful is one by Thich Nhat Hanh, and here he's pictured with Martin Luther King. They became friends during the Vietnam War, and after hearing of his, Martin Luther King hearing of Thich Nhat Hanh's journey of trying to bring peace to Vietnam, he nominated him for a Nobel Peace Prize, and they became friends. And Thich Nhat Hanh is continuing to do wonderful work to support mindfulness and compassion. So this quote from him is, "Awareness is the first practical ethical action available to us. To do something effectively and ethically, we need to be our best selves in order to be able to handle the suffering." So this talks about our aspiration to address this burnout, to address this sense of being overwhelmed, and tying it to this ability to have this attentional stability and clarity, this awareness of the present moment, so that we can really see what's in front of us rather than the stories that we have about what's in front of us. As we develop this skill of attention, we can be more available to what really is. And another person that we like to lift up here is Anton van Leeuwenhoek, who is the father of microbiology. And it turns out he liked to polish lenses. And as he was polishing lenses, he discovered that there was a lot of different things going on beyond what he could see through that lens. And so the parallel is we want to focus polish our lens of attention so that we can perhaps see beyond what we initially can see and get more information from this present moment.
So these first two modules, Module 1, Attentional Stability and Clarity, and also Module 2, Insight into the Nature of Mental Experiences, encompass what are commonly referred to right now in our country, at least, as mindfulness practices or basic mindfulness practices. The one that Maureen just described was about learning how we can focus our attention on something very particular and notice when we get distracted and then come back. Module 2 is uses the same kind of present moment skills, but doesn't try to stay with just one thing. It actually moves toward what you may have heard. You may have heard mindfulness described or defined as non-judgmental awareness. That's what Module 2 is giving us a chance to practice. Can we just allow things to come up in the mind and then come and go in a way that we aren't so reactive to them? They don't become drivers of our behavior the way so often our mental activity is. So this is where the mental flexibility, and I recall that 23% of you voted for mental flexibility. So this is where that would be developed. A sense of, it's not that I'm rejecting what's in my mind or ignoring it in any way. It's just that I'm realizing that, that thought about my, this particular concern is one that I don't really need to, it's one I've had for the last 15 years. And I've had this thought, 473 times already today, and I don't need to have that one again. I can let it come and go. But it doesn't mean that there aren't also thoughts and impulses that come like, I think I should really call my poor aunt who's in the hospital and wish her well. That's a thought I want to go with. So it's not that we're just becoming zombies, not reacting to anything. It's that we're getting this flexibility. It's kind of a new way of relating to thoughts. And for those of you who have tried mindfulness practices, this may be familiar. We have another, just a thanks to Caroline Santos and Donnell Bethia, who agreed to sit for these videos, young, recent resident graduates from Emory's chaplain training program. agreed to sit and talk about their experience with CBCT. So we have another clip to share that's related to this. And let's see, I go to this one.
Yes, when I am learning something and whenever it captures me that I believe it is something I can be used every day, I am making it a regular practice as a part of my daily life. So I am taking CBCT that way. It's helping me a lot, especially watching over my thoughts. This is beautiful. I think I used to judge my thoughts, like this is good, this is bad, this is not working. And with such judging, I have these feelings of, if this is not good, then the feeling is not good as well. And if the thinking is good, then the feeling follows. But then I have learned just to simply allow my thoughts to be there. And CBCT taught me that way. Allowing things to just come by and pass without judgment helped me to live, I think, a less stressful life. Lesser stress, and I think I need more practice in order to master that, but I know it's helping me a lot. So CBCT is not just a knowledge for me, it's something that I can use every day.
So I love to hear her talk. So wanted to say a word too, that we're going through these pretty quickly, these insights, and just want you to know that this is a whole course. This is usually taught over 10 weeks, an hour and a half per week, or in 2 intensive weekends, or as we taught with the chaplain residents, 4 weeks, 1 day, full day per week. So we really get into much more description of what these core concepts are as part of the course. But we wanted to point to them today to let you know the overview of the program. So the next module is self-compassion and self-care. And as we know in our work, this is huge. And as you all indicated in the poll earlier. So one of the things that I know I do, and I think we find that and the CBCT helps to illuminate, is that we can get very narrow in our focus when we're stressed. And so when we're very narrow, if we could get this skill of building the muscle of broadening our perspective, that can perhaps bring some relief. Because there's inevitable suffering that happens in all of our lives. And in self-compassion, we're looking at how we may be adding to some of that through some of our thoughts about what's happening, the stories we tell ourselves, the harsh judgment we tell ourselves about what's happening. And then that can really pull us away from perhaps using our warm-heartedness, using our resources to address the inevitable suffering in the way that we would like. So in this module, the analytic meditation that we talked about, we're starting to look at how we can broaden our perspective and see how we can look at these sources of suffering, these sources of distress from different angles. One of the core aspects of this is that we all have this fundamental desire to be free from distress and pursue happiness, and that when we see when something does come into our life that causes distress, how can we hold that through taking these different perspectives. So a slide that just kind of reviews some of these core skills of self-compassion, and then we'll see a few more videos. To accept the reality that outcomes are not 100% in my control because of many factors and circumstances. Again, this is a great example of a concept that we can get. And as we dwell with some of the meditation practices and deepen that, we can get more of a felt sense of that reality and perhaps broaden our perspective about that. Distinguish inevitable difficulties of life from the distress I experience in reaction to them, as I was saying. There's one more. And embrace, this is a huge one, embrace my limitations and vulnerabilities with kindness and acceptance. You know, in fact, I have this on my desk. Because to really dwell with that takes time to really get that to be a felt sense that we can access more spontaneously through this practice. And so we have another So we have 2 videos concerning self-compassion by our former residents.
Yes, CBCT helps me to take a pause and to realize that it's important to help people, but at the same time, I do have to let the situations go with the patients because there's only so much we can do to help a particular patient, and I want to overhelp sometimes. So it just helps me to remind myself that I've done what I could do, and it's time to, let that encounter go and move on to the next one.
Another thing that's helping is the mental immunity. It's how we reframe things. That as I am engaging with patients to help them reframe things according to their experiences, I am doing the same thing for me as well. There are difficult encounters, but we can always look at several ways. And when we look at it differently, we will feel different about certain things. That is one thing I think beautiful about CBCT. It helps us to look at something with different perspective. And when we learn to look at something with different perspective, it is changing the way we think. And when it's changing the way we think, it definitely changes the way we feel about certain things. And there's something more beautiful that's coming. Life is easier to respond to care seekers, and it's not easy, but it's not difficult as well because we have a certain crowd where we can always go.
Certain craft that we can always go to. So this idea of, like she was saying, looking at things from these different perspectives can bring so much relief. And as we've been processing some of their cases, as they've been using some of these practices, we can feel that kind of felt sense of relief as they get more of that felt sense of how to call on that skill. And we can talk just briefly here about wise compassion, and we can talk about that some more as we go out throughout the webinar. But this idea that we want to have wise compassion. So when we are coming across things that are challenging to us, that through this felt sense of these skills, we can perhaps have a sense of how to create boundaries that are taking our needs into consideration as well as the other person's, but knowing that this is not about foolish compassion. It's about accessing what's going to be the best practice for our overall wholeness. And we can talk more about that in relationship to some of the other modules as well.
So thank you, Maureen. Self-compassion is one of the parts of CBCT that we always spend at least more than 1 week on, if not 2 or 3 weeks. But really all of these first modules we've talked about, the resting in a moment of nurturance, attentional stability and clarity, insight into mental experience, and self-compassion are come together to support an individual's resilience. Each of them is an ingredient to my ability to weather the ups and downs of my life and bounce back, to stay in it, to not get either upregulated, too anxious, or depressed and kind of giving up. So really we see compassion and resilience as the 2 primary outcomes of CBCT in some ways. You can't, and they help each other. So resilience is the first part. For these last 3, we're not going to go through each one in detail, but 4, 5, and 6 are now a chance to take all that I've learned about myself, my own distress, how I work with that, the way my mind works, my attention works, and now turn to others. And really, the first step, if I've really embraced how much I would like to be well and free from distress, and yet see that my life has its vulnerabilities, if I then look out at others, I realize that everyone else is just like that too. We're very similar in that way. So this module 4, cultivating impartiality, the whole focus of that, before we even get to that kind of affective sense of, let me see what I can do for you, we just focus simply on my capacity to identify with others. And I'm remembering that this one had the least number of votes, I think. This is where we put inclusivity on that sunshine chart. And yet, I think the truth is all of us have certain biases, certain blind spots. It's just sort of the nature of a human being growing up in this society that we've grown up in. And we've developed certain ways of not quite seeing the suffering of some people and being more attuned to that of others. So this is just a chance for each of us to ask that question, do I see how similar each of these other people are to me at a very fundamental level? It is so easy to notice differences. We're very good at that, and to focus on that. And this isn't about not respecting the differences or appreciating them. In fact, I think the more we see how similar we are at some basic level, the more we can appreciate the beautiful differences that we have as well. So really, it has spiritual ramifications. I think it does, but from our perspective at CBCT, we're starting with science, and this man, Dr. DeWall, is an Emory primatologist. He's written a beautiful book called The Age of Empathy and several other great books about 40 years of studying primates. And one thing he's decided, primates are very good at empathy. Mammals are good at empathy. Mammals wouldn't be successful as species if they weren't able to care for their young and understand how they're struggling and suffering and take care of them. But his observation is that identification is the primary portal for empathy. So if we don't see ourselves in another, that they're like me, then we're not going to take their perspective. We're not going to see their point of view. So this is step one in both establishing a sense of closeness with others, but also attuning to their struggles, both of which, as we'll see, are so important to compassion. So we have one more video from Donnell talking, one of his stories reflected this insight. Let's listen.
Yes, one encounter I had was with a young man he was really young. He was sick and he didn't have any family support or anything like that. And it was an extremely lonely time for him. And what I did during that encounter is I looked at him and said, this guy is just like me. He's just like me. He just wants somebody to care for him, and he wants to care for somebody. So I'm very similar to him. So I just journeyed right along with him and was able to reach out to him and let him know that I care for him and I'll be here for him as much as possible.
So, when we use the word inclusivity, and that has kind of maybe political overtones these days, but what we really mean is something much more personal, intimate than that. A sense of this practice allows us to catch those moments when we have a sense of kind of disconnection, like this person I can't really relate to. And then we catch that, and just again through practice, because who among us is going to get this just right? We can start saying, well, actually, let me just remember this person is like me, and there I can just start from that level. And you may appreciate the physicians that we teach this to. Some of them really are surprised they enjoy this practice too. They read the chart, they get their white suit, they're ready to go into the room, and they just, as they open the door, they remind themselves, whatever my relationship with this patient, still I'm the doctor, I have the authority, I have the knowledge. At some basic level, they're like me. At the most basic level, they're just another human being. And many people report this shifting the way encounters unfold, the way things happen. So,
So to summarize these modules, and again, we would go in much more detail in the full course. These last two, Module 5 and Module 6. So we're taking all these sequential skills that have built on each other, and we're summarizing them in these two pieces. The warm-heartedness that we started with the sunshine slide, really that cultivation and that ability to sustain that, CBCT is advocating that you really need to continuously practice those prior skills to build on each other so that you can have this spontaneous sense of gratitude for others, which we talk about in Module 5. The sense that we are connected in this infinite interdependent web, that everything that we get in our daily life is really a gift from others. And we cultivate that sense, not just out of will, but out of this sequential nature practice, as well as accessing our own traditions, our own faith traditions, as we would like. And through that culmination of those skills, we can generate more spontaneously out of that gratitude that leads to this natural affection that can arise, and this warm-heartedness that can be supported in a more sustainable way. So we take all those different skills that have added up to this warm-heartedness, plus the awareness of suffering. And that can lead to compassion. And really, the compassion can be this endless well that we pull from, as Tim was saying. It's when we try to have the empathy, the awareness of the suffering without these skills, this warm-heartedness that we're summarizing with that term, that we are going to have burnout. But if we can bring these two together, that can help us to sustain compassion and access that well of compassion that won't run dry. In a poetic way of saying that. So that's our summary of the slides around the hopes for the modules. Yes. Yeah.
One last video.
I think at first I am pessimistic about it. I don't usually do like the breathing meditation. I don't usually engage with that, though I do the breathing exercise because some of the subjects in my clinical or counseling field requires us to do that. But as I go through, I am amazed how this thing is deeply founded in my being, like the call to love, to be compassionate, to the call to understand the processes, the internal processes that I am having, my mind, my feelings, my action. And slowly it's making sense.
So we're coming to the end of, yes, we're coming to the end of presenting the kind of practical and conceptual parts of compassion-centered spiritual health. And we just wanted to show this slide again. Hopefully these words have a little more meaning to you now when you look at them and you consider them all as really like ingredients. Like if you were going to bake a cake of compassion, you would need to have all of these ingredients and put that into the oven at just the right temperature. And of course, you would want the best possible ingredients, if you really appreciated that cake, So we wanted to conclude with a little bit of a fable or story that comes from what we've heard from the Cherokee Native American tradition, although I've also heard it ascribed to other Native traditions. So we don't know exactly where it comes from. Perhaps you've heard it. It's called The Two Wolves of the Heart. And the story is that in this village, there's an elder who's particularly respected. grandfather or grandmother who's seen as one of the wise, kind people who everyone will go to when they need help, when they need counsel. And the grandchild comes to them one day and says, grandparent, please tell me, how did you become such a wise, caring person who everyone turns to? And the grandparent said, oh, my grandchild, well, all my life I've known I have these two wolves living in my heart, the wolf of love and the wolf of hate. The wolf of the love, this wolf has so much generosity and kindness and friendliness and gratitude and affection. And the wolf of hate, it has this meanness and this stinginess, and it's very self-centered. And the grandchild, gets these big eyes and says, oh, grandparent, how do you know which one's going to win? And the wise grandparent says, well, it just depends on the one you feed. Depends on the one you feed. So when we heard this, we just felt like this is a very practical approach. How do we feed that part of ourself that naturally has these characteristics already, but we want them to be the ones that shine through, especially in when things get tough. So that's that. And then we have one more poll. And we want to offer this to you as a kind of review of what we've done in the last hour and 20 minutes. These 3 points, we're just interested to hear from you. Which one seems the most relevant? And actually, we're giving you the chance to choose as many as you'd like. So the first one, compassion is an antidote to burnout and empathic distress. Actually, let me go ahead and start the poll, and you'll be able to work on it. The second one, maybe you could read them, Maureen. Oh, you can.
Second one is sustaining compassion depends on various skills that are trainable over time. And the third one is the skills of compassion training support and align with the skills of spiritual health provision.
So there it goes. And we'll give about 30 seconds for you to enter the ones you resonate with most. Thanks for your patience, those of you in the room. He's not showing it.
Here it's just the bar. We can't see. It's okay. Maybe we'll do it there.
There we go. Okay, so we give about 10 more seconds. We've had about 2/3 have responded. Okay, thank you. So sharing the results. The most votes were for the middle one. Sustaining compassion depends on various skills that are trainable over time. Wonderful. And the other points seem fairly relevant as well, apparently. So that's good. Thank you. So before we go into the next section, is there anything coming from chat that we should be addressing?
Just ask resources in our local area. How do we access this resource
Yes.
in our local area?
How do you access in this local area? We're going to talk about that. So how you can get involved and what's available. We'll talk more about that. It's coming.
Yes, so here's another visual of our compassion-centered spiritual health, one of our images related to that, our effort. And here we have Dr. George Grant. He was in the room with us. And he is our executive director of spiritual health at Emory Healthcare and has really been a leader along with Professor Lobson Tenzin-Negi and all those at the center, of course, including Tim. Has been a major leader in this as well. But George has been a visionary leader in this effort of compassion-centered spiritual health, and we're very grateful to him in our ongoing efforts and his wonderful support and ideas. And what we're hoping for as this develops is this idea of, I don't think I mentioned before, of tending the personal, as here in the chart, interpersonal and systemic aspects of our work. And we're hoping that as we continue to engage in this work, that we'll see how that naturally unfolds to impact positively at all those different levels. So just again, a few reiterations of why we exploring this compassion-centered spiritual health. And again, just to reemphasize, it offers a consistent, systematic way to understand and deepen skills for navigating the varied emotional and behavioral responses required as spiritual health care practitioners. I think Carolyn said it beautifully about how she became more in relationship to her inner world in terms of not judging her thoughts so harshly, just letting them come and go and getting the information that she needed from them, which we've heard from other residents that are taking this curriculum that helps them in the middle of a visit, check in about what's happening, managing their own triggers so that they can become more present. Again, this is very, very much the work of CPE, and this is just another undergirding systematic way of engaging that. As Tim was saying, fosters resilience in the face of suffering of self and others through all these collective skills. And cultivates perspective takings to enhance cultural competence. So as you can hear, throughout the modules, as we go through them, we're really doing our own personal work so that we can be grounded and present, so we can become more available to the other person. And then as we cultivate these skills of, like Tim was saying and Donnell was saying, of just like the folks that I'm with are just like me, I can get more of this humble curiosity to lean in, to say, oh, they have this perspective that I don't know, because we are connected, but they are a unique individual. So I want to lean in and really hear their perspective and how I can be supported to them and have reverence for their perspective. As well as this helping with the providing spiritual health to people of all faiths or no faiths. Again, we are tending these skills so that we can be more available to hear the needs of others without imposing our own agenda through these skill taking. Again, we'll recognize this as a significant part of the work of CPE, and this will hopefully help to support that. Contributes to the institution-wide conversation about and encouragement of a culture of compassion. This gets at that systemic level. So one of the things that we were just finding at Emory, for example, is that, as we said earlier, so the nurses are getting this training, the physicians are getting this training, others in the healthcare training, the chaplains. So when we were helping to teach the nurses, they said, oh yeah, we always go to the chaplains. We ask them to come by and share with us their perspective of CBCT and how they're using this in their work. So it starts to support this crosstalk across the institution, a common language of understanding how we can support each other in this work of cultivating and sustaining compassion. And very importantly, provides research-based, efficient, and effective, but we're hoping we're going to do research, bedside interventions drawn from CBCT. As you can hear, as in the presentation that Tim went through earlier, there's so much research about CBCT, and we're, again, grateful to be part of the continued research. And we feel it aligns this compassion-centered spiritual health with the competencies and the action, reflection, action, learning model of ACP, CPE, and spiritual health. Process learning. So this is a very dense slide. So we're not going to go through all of this, but we can get you this information if you like. This gives more detail about how to get involved. So I'm just going to go over this quickly so we can get to some more questions. Again, that we are really wanting to offer this in support of the ongoing work of our spiritual health professions, ACPE, AAPC, Association of Professional Chaplains, the Canadian Association for Spiritual Care, Association of Jewish Chaplains, and the National Association of Catholic Chaplains. So we really want to support people going through these processes as fundamental. For individuals who are interested in more, there's the path. Let me just say briefly, the path is to get the foundation course first. And we'll talk about some different ways of getting that foundation course. Then once you have the foundation course, and probably in fall 2019, we'll have more availability of the interventions, because right now we're just beginning to do research on those. And then you can go through the intervention training that's inspired by the CBCT. So we were just talking about this today with some of the residents taking the training, that they're noticing as they're taking their own CBCT, as they're practicing it for themselves, they start to notice more how to use effectively the interventions, which makes sense, because they get this more felt sense, this embodied sense of how to attune to the other person through their own practice. So you can do the intervention training when that becomes available. And then of course you can become a CBCT instructor if that's something of interest to you. And there's a whole separate program for that. And then in regards to compassion-centered spiritual health specifically, you can become trained to teach the interventions of CCSH and then become a registered CCSH teacher. That would include the foundation course, the intervention training, becoming a CBCT teacher, and then becoming an instructor of the interventions. So we have this pathway. We also have hopes of developing some institutional partnerships, and we can talk more with folks about that. And then, of course, individuals who are not a part of the institution can absolutely go through this path as well. Yeah. There we go. So just wanted to note that appreciate Amy Green, who's our board chair of ACPE, who wrote this recent article in the ACPE News about her own work of becoming a certified CBCT instructor, and her hopes to bring this to her work at the Cleveland Clinic. And as she talks about, just read this one piece, "It is no exaggeration for me to say that this practice and the work of becoming a certified teacher so that I can start conducting the training regularly at the Cleveland Clinic has been a life changer and lifesaver." I had, so she was just naming how important it's been for her, as well as her hopes to bring it to her institution. We also have other educators who've gone through the training, Jamie Beachy, Jose Montenegro, and Caroline Peacock, and we're excited about bringing even more chaplain educators and folks in APC and across all of our cognate groups to be a part of this training as they would like. So we have ongoing courses that happen here, and then Tim, please feel free to talk about this as well. We have one coming up March 8th through 10th, and we'll be sending a follow-up email with how to access the website to register for this. This is in Atlanta. It's an intensive weekend. We're experimenting so that it's 3.5 days rather than 2 intensive weekends, so that folks, in terms of that, can be more supportive of people's travel. So March 8th through 10th is the next one at the Drepung Losling Monastery here in Atlanta. We also have another training coming up May 23rd through the 26th at the Monastery of the Holy Spirit in Conyers, Georgia. And we have very limited spaces for that, but we will let you know about the registration for that. And we also have one way out scheduled in February of 2020 at the Monastery of the Holy Spirit in Conyers, Georgia as well. And that will have more spaces. And we're excited about having that, our practice there at the monastery. It's a beautiful place if you've never been there and if you're traveling. Do you want to talk about how other ways they can get the training?
Well, if you're in Atlanta or near Atlanta, there's a weekly course, an 8-week course on Wednesday evenings that starts in mid-January for 8 weeks. And otherwise, Emory offers this 4 times a year to the public. The one that says at Drepung Losling Monastery, that's where it's held, but it's actually an Emory University program. We just meet at that monastery, which is not far.
Yeah, and we have traveled to different institutions as well.
So if there are enough people at an institution to form a course, say 15, 20, 25 people, then it makes sense for us to bring our certified teachers to that institution. That's what we've done at the Cleveland Clinic and Cambridge Health Alliance and other places. So yeah, if there's that sort of interest, then that by all means. Peoria, we've done it, and happy to do that. So.
And we will have this recorded webinar available on the ACPE website for a limited period of time, because we're going to get updates as we get more involved in the research and the results from that. We want to update you about how that's going. So what other questions?
Maybe we could open it up
Yeah.
to questions at this point. Do we want to leave that on
Sure.
as a way of I guess I'll just say thank you all for attending. We've actually got through this a little faster than we thought we would, which is great. So now hopefully we can cover some questions.
Two bottom ones, I think.
Two bottom ones, all right. Where can one find out the charges, like the costs? I think that that just depends on the number of people and the location, and it's probably a matter of just contacting us, starting a conversation.
I know that several places were, as they've heard about the program, were trying to get their networks together so that they could sponsor and get many different institutions to sponsor a class locally, and so many people could come at once and get the foundation training.
The basic CBCT course is typically between $400 and $450 for the 8 or 10 week course, or the weekend intensive, depending on how much, lunches are included and that sort of thing. So that's one cost we know. Online possibilities. We would like to develop online a CBCT course, and we're hoping in this next year to do that. The teacher certification, if you really are excited about this and you're thinking, oh, I would like to not only learn to practice CBCT, but also teach CBCT to others, either just as an individual or as part of a CCSH, Compassion-Centered Spiritual Health partner, then the teacher certification program runs once per year. It starts in the summer, goes for about 6 months. There's various parts to that. And you can read about all of that on the website for CBCT, which I don't know if we have that.
It's going to be in the follow-up email, the compassion.
Yeah, we'll send a follow-up.
Emory.edu.
Yeah, compassion.emory.edu is the website. And that is a program that you can do largely from a distance, this teacher certification program. There are 2 parts of it where you would need to come to Atlanta and take a week-long training at the beginning and then a weekend toward the end. So, yes.
My question would be about literature. What literature is used to support this information in terms of books that you read and study through? That's part of what I'm interested in. If you want to read about this, is there a bibliography that supports this?
Yes, that's a great question. So the first thing that comes to mind, we have a resource list with books that, and there's, this idea of compassion science is a pretty new idea. I think maybe in 2016, I was able to attend the first ever Science of Compassion symposium. Of course, we're out to San Francisco. They're very exciting. The people are trying to study this sort of thing. What does it mean? How do we measure it? So there are a lot of books being written about it, and I'd be happy to share this resource list with you. I don't know, maybe we could include that in the follow-up email. There's a book, the kind of the real pioneer of meditation research, Richard Davidson, is at University of Wisconsin-Madison, and he's built this huge lab looking at measuring what happens in people's brains when they're doing these practices, looking at behavior. And he has collaborated with Daniel Goleman, who's the author of Emotional Intelligence back in the 90s, and kind of pioneered social emotional learning through his thinking. They have a recent book out called Altered Traits, The Science of Meditation, something like that, trying to clarify fact from fiction, like what does this actually do? What are its limitations? It's a very nice book, so that would be one we could include. A more, one that we like to hand out a chapter to our, when we train the chaplains, is a book called The Book of Joy, which is an account of a week that the Dalai Lama and Archbishop Desmond Tutu spent together when they both turned 80 years old. And they've become friends over the years at various interfaith conferences. And it's just a wonderful book of these two wise men sharing their perspectives on life. It's valuable. So between those two extremes, the science and the more religious view, there's other books too, but we'd be happy to share the list.
Great question. Another question.
More
They're asking us
questions.
to
Oh,
make
now
sure to
they're all
repeat the
coming up.
question.
Oh, the question. Okay.
Of the university.
Do you know when the trainings are at the University of Arizona? No, but if you look at the Compassion Center, I think it's actually called the Compassion Center at the University of Arizona, Tucson. You will find, you should find a list. And they teach other programs as well as CBCT. So say hi to Leslie Langford there if you talk to her. She's executive director and is one of our 3 CBCT teachers in Tucson. Will you be posting updates on your website when you are at another location out of Atlanta?
It's a nice idea. Like if we get a sense that there are several places locally that would like to combine efforts. And also we can talk about how to post that on our website. And I don't know if there's space to do that on the compassion.emory.edu, but we can look at posting that on the spiritual health website, which we're currently redeveloping right now.
Actually,
Yes.
I'll leave this
Yes, that's
up.
good for our
I'll
contact.
leave this up.
Yes.
You have the next one. What would be the arrangement to have someone come to my institution to provide a lecture? Just email either one of us and we'll work it out. What would be the arrangement, you think? I think emails.
Yeah, email us would be great for the arrangement.
And also, if you can repeat the questions from here.
Oh,
that question. Okay. Sorry. So the question we asked earlier from the audience here was, what is the literature that supports this work, these practices that we're drawing from? So, Maureen.
What is the difference between CBCT and mindful self-compassion work of Neff and Germer? That's a great question. Just was privileged to be at a conference where a lot of the most researched compassion training programs were together up in the Omega Institute in New York, and we all sat and listened to each other's programs. And of course, there's this common theme of developing these skills. And CBCT just has its own unique flavor, and the research behind it, I think, is one of the unique pieces about CBCT. But of course, we support all these different compassion training programs. Is there anything that you would say?
Oh, it's pretty clear. I mean, we've become friends with Chris Germer in particular over the years because he invited us to the Compassion, the Cambridge Health Alliance to teach CBCT, where they also teach mindful self-compassion. But from this Omega conference, it's pretty clear that the similar ingredients are there in each of the compassion training programs. There's also one out of California, Bay Area, at the Compassion Institute called Compassion Cultivation Training. The difference between the programs is their program focuses very much on self-compassion, and it's the central piece. It kind of goes into it with some, I'm not to say it, but I've never taken it, but it seems, on the other hand, they have the same theme of recognizing common humanity, not forgetting that everyone, I'm not the only one struggling with my particular troubles or limitations. Everyone also has these limitations. So,
I would say just one of the other dynamics is that we are doing this research, particularly with CBCT, with this CBCT-inspired interventions at the bedside. And what I really, again, am excited about is this paired opportunity for people to do this at their own pace, to deepen their skill while doing the interventions that are paired with the CBCT insights. And so as we do the research and as we work together, we can continue to work together to refine those as a community of spiritual health.
yeah, I think it's worth adding. I think that the reason CBCT has resonated with the healthcare professions is because it doesn't, it has self-compassion as part of its practice, but it's definitely doing these resiliency, self-care practices so that I can be more available to others, so that I can activate, because it's the profession, whether you're a chaplain, a physician, a nurse, tech, even if you're the person who works at the front desk receiving people, it's part of why you're doing it is to care for people who are suffering. So I think the compassion focus of CBCT is what's made this so kind of resonant for people in the healthcare professions.
Is the basic training included in teacher training, or is it a prerequisite? That's a great question. So yes, so the first step would be to take a CBCT foundation course, those different options that we were naming. Yes, that would be the first step, and then you would apply for the teacher training and get the training in more depth.
You really would want to make sure it's for you before you commit to the full teacher certification. What do the training module experiences look like? Perhaps a combination of guided meditation and group debriefing? Yes, and including other exercises as well. The teachers are trained primarily in the practices for themselves and then in the principles, familiarizing themselves with the science and the research and the literature. And then if you bring, as a teacher, you bring this to foster care kids, or you bring it to chaplains, or you bring it to young doctors at Emory Med School, the way it's taught might look different. The common elements are always the seated, inward, introspective practices. But group debriefing is pretty standard as well. But there are also some wonderful exercises that our teachers have developed that are interactive, journaling or drawing on the wall, so that it's more engaging for a variety of type of learners.
And we've enjoyed experimenting how to make this as vivid for our chaplain residents as possible, utilizing different ways of integrating the faith tradition into the training.
Okay.
Yes.
Another request for the resource list in a follow-up email, so we can do that for sure. Read.
Are there classes scheduled in other places besides Atlanta which we might be able to participate in? We have 4 or 5 who would like to attend. We are in Michigan.
Yes.
The light's just gone off here.
Well, they're showing up in different places
Yes.
around the world, but email me, please, from Michigan. We have a number of people being trained in that area right now. So maybe we could get someone toward you or near you. We have someone in Chicago, for example, training. I don't know how close that is to your part of Michigan, but nothing in particular in Michigan right now, I'm sorry to say. How long would a CCSH intervention take at the bedside?
That's a great question. Yeah, this is something that we're leaning into and learning. And one of the values that we have behind putting this intervention inspired by CBCT together is we want to be as effective, offer as meaningful care as we all do, in a way that can be economical when needed. Because we know that there's many different factors. Sometimes we just have a very brief time with folks. So putting together some of these core insights into some core stages that people become familiarized with, and then the more nuanced practices can be offered as people get more confidence in CBCT for themselves. So it can take, just like at any of our visits, it can take a range of time, but we do have as part of our values trying to have some economic quality engagement with our care seekers.
But the short answer
Yeah, sorry.
is 7.5 minutes.
Oh, that's right.
That's why I was laughing.
Yeah.
It's kind of an in joke with us, but
Yeah.
7.5 minutes is the.
Yes. Yeah.
Oh, is it only 7?
That's
You
it,
know,
I think,
but
in general for
I
healthcare.
think
Yes.
one thing that's just, I mean, you're all, I suspect, in this field, but from outside this field, something amazing. You know, Emory started tracking the number of chaplain encounters about 4 years ago, and they were logging every one of them. And last year they did it. It was in their 9 hospitals, more than 100,000 encounters were logged. And over a third of those were with staff, not with patients. So if you do the math, it can't be much longer than 7.5 minutes. But of course, some of them are much longer. I think, you know, as they've been taking this for a trial run, there's some that are 2 hours, but also these little bursts of insight and help can be done in very short periods. So anyway.
A common question was about the PowerPoint presentation of science.
Yes. We will, I mean, this will be a recorded session, will be made available on the ACPE website. So anyone could watch this again, or you could share it with others. The slides is a huge slideshow. We can't share the whole thing with all the videos. So we can definitely do an edited version with the key concepts and make that part of what we share, probably as a PDF, so that you can have all of that. So we'll plan to do that. Great.
Well, just want to say, add my words of gratitude. I'm just so grateful for our community and for this opportunity to present this with you all and to continue the conversation and the engagement. Very excited to be part of this journey. Thank you all for being here, for taking the time.
Likewise. Thank you.
Yes, thank you.
Everyone have a wonderful Thursday evening,
Yes.
wherever you are.